Hey guys, it's Dr. Jenny with Nature Matters Academy, and here we're talking about snake bites, and specifically, what do we do about a snake bite? What do you do if your kid gets bitten? What do you do if you get bitten with your kids? And today we have Jake Gray, who is a paramedic and fireman as well as a father. So he has the same concerns that you do, but he actually knows what to do in this situation. So that's what he's going to talk to us about today. So I have a list of questions that you guys submitted about a week or so ago, and we're just going to kind of work through these. If you have any questions while we're on the video, feel free to type them into the text, and we'll see if we can answer those too. So let's start with the kind of the big obvious question. So Jake, walk us through what you should do if your child is bitten around your home.
Sure. So first thing you want to remember, obviously get them away from the snake, right? And then you would want to make sure that you stay calm and try and keep them calm. Okay. The more their heart rate goes up, the more that the toxins are going to get delivered into their body. Okay. So keep them calm, console them, get them into the house. You can wash it off with some soap and water. Don't put any ice on it. Don't try and use any tourniquets. You want to just try and, like I said, clean it off, maybe put a sterile piece of gauze over it, and get them to UNM Hospital. Okay. UNM is, to my understanding, is the only one that's carrying antivenom. Right? Okay. So in Albuquerque, UNM's the only one that carries antivenom. Yep. And then, so as far as people who don't live in Albuquerque, so let's say they live in Chicago or something, how will they know which hospital to get their kid to? Should they call poison control, or maybe just call 911 and see what they tell them to do? So you can, if your child starts having shortness of breath, starts going unconscious, the swelling seems like it's spreading really quickly, they start swelling in their airway, any of those types of symptoms, you would want to call 911. Okay. Yeah. Sounds good. All right. So this is kind of a question based on, what do you do if you're not around your home? So obviously at your house, you have cell service, you can call 911, you can call poison control, whatever it is. It's easy to get help. But what happens if you are out camping or hiking and you run into this situation with both your kids, but also you? So I think about the fact that there are so many moms that I run into in the trails out here that are hiking alone with their children. And so what happens if it's mom that gets bitten and you have little ones with you? What do you do? Right. So again, get away from the rattlesnake. You're gonna have time. It's not like, as soon as you get bit, you're gonna keel over. Right. You have time. So go ahead and just stay calm and start hiking out. Okay. Once you have cell service, since you're gonna have a delayed response to get treatment, I would probably go ahead and call 911. Okay. Go ahead and get an ambulance there. Get an ambulance going as soon as possible. Right. Okay, great. Anything else? So as far as identifying the type of rattlesnake, yes. We have diamondbacks and prairie rattlers are the primary rattlesnakes in this area. There's a few others, but they're the primary ones. It's the same type of antivenom that they use for the different species. So you don't need to try and chase down the rattlesnake or take pictures or kill it and bring it in. Okay. That's what, that's going to be my next question, is because that's what I hear a lot, is that you should take a picture so you know, but at least in the Albuquerque region, that it's not, I'm sorry. Hey, Callan? I don't know, honey. You need to ask your daddy. Sorry. So we're having dinner here, lots of kids, neighbors' kids. We're having a good time. So in this region, so if you're in the Albuquerque region, you don't necessarily need to take a picture of it because the snakes are the species are similar enough, the antivenom's the same, so it doesn't matter. So I'm assuming that there's probably regions where the venomous snakes are different enough that it might be beneficial. So is that one of those things that maybe just in case? Or do you think that might be okay? If you can get a picture of the snake, or you can kill the snake without putting yourself at risk, then yeah, you could do that. Okay. Just chop its head off and take it in. Okay. Or, take a picture of it. But I would say in this region, I wouldn't even take the risk. Yeah. And it's probably the same in other regions too, because hospitals are going to know which venomous snakes are around, and so they're probably going to be similar like what you said. So, okay, great. So this is something new that I've never heard of before, but some people suggest that you should give your child Benadryl on the way to the hospital. Have you heard that? It's not in our protocol to give Benadryl for a snake bite. Okay. If they were presenting with an anaphylactic type of shock reaction, we would give them Benadryl.
Okay.
So if you saw them break out in hives, they started having swelling in their mouth, their tongue, their throat, shortness of breath, you could give them some Benadryl.
Okay.
Like I already said earlier, if they're starting to have those symptoms, you need to get us.
You need to call 911 and just be done with it.
Yeah.
So yeah, you're not going to get them Benadryl as they're starting to have a systemic reaction.
Right.
No, that's a good call. Okay. So this is one that's really important, because if you go to even just a regular store like Walmart or your outdoor stores, you see these snake bite kits, right? Where you can suck the venom out. So tell us a little bit of that. Is that worth the money? Is that something that people should definitely not do? What do you think?
We don't recommend it.
Okay.
They're finding that it's not as effective as they once thought, and that it's actually pulling the venom into a concentrated area and causing more tissue damage.
Okay.
So
Right.
they don't recommend that you do the cutting and sucking or the snake bite kits, or even one time they thought to maybe shock the area with like a stun gun, and it would neutralize the toxins. That doesn't work. That doesn't work either. At one time they thought tourniquets,
Okay.
but that's not recommended anymore.
Okay.
Yeah.
So really it's just about getting them out.
The big thing is to get them to the hospital,
Okay.
so they can give them the antidote. And so, like I said before, if they're presenting with symptoms other than just ouch, it hurts, and there's a little bit of swelling, if they're having any type of shortness of breath, if they're starting to lose consciousness at all, if the swelling becomes gross quickly,
Right.
then those type of things, we need to be there so we can administer some different medications that can treat their shock.
Okay, great.
Yeah.
Excellent. Is there anything else that we need to know? We basically have gone through all of our questions.
I don't think so.
So, okay, go ahead.
Oh, I was gonna say, if you're really curious about rattlesnakes, the Rattlesnake Museum is a great place to go, and
That's
he has
great.
tons
Yes.
of information on snake bites and stuff too.
Yeah, no, that's a great idea. So in Old Town,
Somebody's backing up.
I have no idea what he just said. So in Old Town, there is a rattlesnake museum, and I think the cost is pretty low. He has all these rattlesnakes in cages, so if you're ever really curious about seeing one live and you're in town, that's something you can do. And I'm sure that, people love snakes, right? There's a certain group of people that
Right.
really enjoy snakes, and so there's probably other museums all around the United States that deal with snakes or venomous snakes. You probably go to zoos and see a lot of them. So if you are just really curious and want to see one, then that's a great place. And the Albuquerque Rattlesnake Museum is a really good place to go. So I do have one question. Why not ice?
So the ice is going to inhibit circulation, and it's going to cause. So rattlesnake venom is a cytotoxin and a neurotoxin,
Right.
So if you concentrate all of that cytotoxin in one spot, and then it causes more profound tissue death. So what you want to do is keep that limb still and just let your body slowly deal with it.
Okay.
And then once you get to the hospital and they're able to administer the antivenom, then it's going to start working against it. So,
Okay.
yeah.
Interesting.
So
I hadn't thought about that.
that's the same with the tourniquets.
Right.
Same with the sucking it and pulling it into one area.
Okay. Because I knew that you wanted them to stay calm because you didn't want the venom to move around, but at the same time you don't want to keep it concentrated in one area too,
Right.
because like you said, it's just going to do a lot of cell death in one spot and do a lot
Right.
of damage.
Yep.
So it's kind of just maintaining that and getting them to the hospital.
Right.
Great. Okay. Well, thank you guys for watching. If you have any questions, send them to me and I will contact Jake and then let you know as the dog comes in and knocks down the camera. All right. Good night. Thank you.